Hello and welcome, Holistic Chamber of Commerce family. Today's member spotlight segment is with Janelle Solomon, and she is going to talk about detecting and preventing inflammation, why it's important to catch this early on. And she is a medical thermography provider. I'm not going to pretend to know anything about that. So I am going to hand it over to Janelle. She has some visuals for us today, which is very exciting, something for us to look at. So welcome, Janelle, and why don't you just give us a little snippet about yourself so people know who they're talking to before you dive into what you want to talk about today.
Sure. Thank you so much for having me. My name is Janelle Solomon. I am based here in Charleston, South Carolina, and I have been a medical thermography technician for 7 years. And I'm going to share a little bit about what thermography is today, but more importantly, why that relates to you and why that could be important to you is if you're someone who wants to be preventative and or proactive and prevent disease, which I feel like our community here at the Holistic Chamber, most of us are trying to do that, then this information will be relevant for you. So I do want to share some history and some images. It's just a lot easier to understand with all of that information. But a little bit more about my background is that I was raised by 2 chiropractors, so I've always kind of been in the holistic field and very passionate about sharing information about what I do here, and it's kind of my mission here on Earth. So I'm so happy to be sharing information with you all today. Let's see if I can get my presentation up here because I'm not sure how this all works, so bear with me for a second. Let's see. Oh, I can share my screen. That's perfect. All right. Okay, I don't know if I actually can because it's asking me to. Can you see my screen?
I see you.
Oh, no. Okay, I think it's asking me to open up settings, so I may not be able to.
Let me see if I make, no, this makes me full screen. I was trying, yeah, sorry, we didn't, this is kind of like a last minute, oh, we're going to share a screen thing. So we did not quite test out the technology here.
Yeah, that's okay. So I can always share. You know what? If you go to the website, if you guys are interested in oh, are you there?
I'm here.
Oh, that was weird. It did a little funny little thing. So I can just talk, and then when you all see this, if you're interested in learning more and being able to see images, of course, you can go to the website. You can contact me. I have an Instagram, Facebook, all the things. So I am a member of Breast Thermography International. So there's also the BTI website that you could go to for information, and it is a national company. So even though you're not here in Charleston, South Carolina with me, you can still look in your area to see if there's a technician near you and be able to have your thermography screening. So just knowing that going forward is important, I think, as well. And why I'm so proud to be a member of BTI and PACT, the Professional Academy of Clinical Thermology, is because the standard that they hold their technicians, the continuing education, the equipment, the technology, all the things are held up to the utmost. So state-of-the-art equipment. Not all thermography companies are created equal, I will say. There are several different companies out there, so you do want to make sure that before you go with a company, you can request a sample report so you can see exactly what you're looking at and what the quality will be like. So a little bit of background on the company there, but thermography, for those of you who are not aware of exactly what it is, it's thermal imaging of the body in order to detect heat and inflammation. So why that's important is depending on where within the body we see the heat and inflammation and how hot it is, it will tell us a lot about the state of your health. So for example, a lot of women come to me to do a breast screening. There is no radiation with this screening. There is no compression. It is completely risk-free and safe. So all ages can get this screening done. You do not need a doctor's referral, although if you are working with your own doctor, they can fill out a referral form for you and then they can receive the results and go over them with you. But if you don't have a doctor of your own, we have a whole team at BTI that you can choose from to do a review with, to go over your information. So you'll get a whole report of basically images of your body, and I call it a heat map. So it's really cool. I wish I could show you the images right here on screen right now, but again, you can go to the website to check out some of the images as well. But what we're doing is not only looking at heat and inflammation, we're looking at your vascular system. We are looking at your lymphatic system. I know a lot of people are talking about the lymphatic system these days. It's kind of become like a mainstream topic, which I'm so excited about, because the importance of your lymphatic system in regards to your overall health it's very underrated, I would say. But it's extremely important. And so what we need to do is be able to see where the areas of congestion might be so that then we can address those areas, clear out some of the congestion that could then lead to disease if unaddressed. So that's the main thing that I love about thermography, is that we are taking a look at, okay, here's some areas that are congested, or what's this hot spot over here? What does this mean in correlation to, your overall health? We can see if there's any dental infection that you might not have known about, heat or cold over specific organs like your thyroid. As you know, I mean, these are all things that are really important in order to assess your overall health. And then we make some lifestyle changes. So even just tiny little tweaks here and there, like implementing dry brushing or getting it into an infrared sauna, things like that, that are going to help get your lymphatic system flowing and, again, break up some of that congestion that could then lead to disease if left unaddressed. And then we do your follow-up scan. So it's not just you do this once and then, I never see you again, but it's a monitoring of your progress. So my favorite part of what I do is being able to see someone come in for their baseline, and we discuss ways that they can improve, which everyone has room for improvement. And then they come back in for their follow-up, and we see major changes and improvements in their scan. And so that is my favorite part of what I do, just being able to see, those improvements over time. And then, of course, the individual feels better, but we're actually seeing the physical, visual evidence of what they've done. A lot of times people can get discouraged because they're doing all these things for their health and they really don't know if it's working or, they're kind of feeling like they're treading water, just trying to stay healthy. But this gives you a little bit of a boost because you're like, oh, okay, this is working. Like I see all these changes. So it's a really encouraging moment when you see that happening on your follow-up scans. So hopefully this makes sense. Again, it's so much easier to explain when you have images to see. But from the information that I've shared so far, do you have any specific questions? Because I feel like there's so much more to cover. And I know that, people might be asking about the interpreting doctors and that whole side of the process, because I'm the technician, so I don't do the interpretations. So I want to make that clear as well. I'm a mobile technician. I travel around the Southeast and see patients out of different doctors' offices. But the interpreting doctors are incredible. They're a team of about 6 doctors, and they receive the results or the images that I send in, create the report for the patient, and then they do the actual interpretation and consult with the patient as well if they don't have a doctor of their own. So that whole part of the process, I think, is really important to discuss, because some thermography companies don't necessarily have, interpreting doctors on that are available for consultation. And I do think that's an important part of the process. You can speak to someone who knows thermography and what it is and why it matters. So that's really important.
I went ahead and I typed in your website, and while you were talking, I went to the website and there were a couple images that showed the colors. Is that what you were talking about? Like you wanted to show. I'm going to see if I can
share your screen.
if I can share my screen and
So the colors are that's what most people know when they think of, thermal imaging or thermography. They're thinking of like all those colors. And it's actually a scale of temperatures. So each color is a different temperature. And on each image, there's a scale to the side that shows you what the temperature is of each color. So in the reporting, it's very detailed, although I don't know if it's going to be the same in the website as an example, but we'll see. Okay. Here we go. There's there actually in the middle image. So thank you for sharing that.
Let me see if I can get it. Nope, that was just me. I'm trying.
Yeah, you're doing great.
All right. Well, I guess that's what we got.
This is what we have. Yep. This is perfect. So if you look on the left side of the screen, these are just examples of patients that we've had in the past. And if you click on each of those, it'll take you to either the breast thermography to book that or information about that, the health screening, which is the upper body, and then the full body imaging. But just so you can see the images, the image to the very left there, that there's a bunch of red in one of the breasts, that is an example of what breast cancer looks like in a breast screening. Then the image right next to it is an example of what healthy breast tissue looks like. So nice and blue, the cool colors, there's no, deep red or yellow and inflammation and things like that throughout the breast tissue. Although I will say, most people have some vascularity through the breasts. This woman just didn't have a lot. So it's pretty rare, I would say, to see completely blue. But basically, we are looking for symmetry with thermography. So because that woman had one breast that was completely red and yellow, and you can see the closed vascular pattern there, you can very clearly see where the breast cancer is. And then compared to the other side, it's nice and cool and blue. The symmetry of that, or the asymmetry of that, is very clear. So they take the temperatures and compare from side to side. And then there's a threshold. So there's normal and abnormal. And the interpreting doctors put all this information in the reporting. The middle option here is the health screening, and this shows an improvement. So on the left, it's someone who had a lot of oral inflammation that was kind of leaking down into the neck. And then you can see where the drainage points are here were, pretty congested. It looks like they got a lot of the heat and inflammation out of the mouth. There's still some work to be done with the drainage area here, but great improvement there on the oral. And then this last one here is the spine. You can see that this individual had a lot of inflammation up in the shoulders and pretty much the entire spine. And you can even see the hips are off. They're kind of torqued to the right a bit. And then in the after, it looks like, I know this particular example was a 6-month follow-up. And this was after she had done chiropractic, massage, acupuncture. She was doing regular self-care to make sure that she was taking care of all that inflammation. And she got aligned, and you can see the result was huge improvements. So yay, at least we got some examples here of what thermal imaging looks like. And then just so you all know, in the reports, there's both the color palette, which is what you're seeing here, and the grayscale imaging, which is a lot easier to see some of the vascularity that's happening in the body. So you get both of those color palette and grayscale imaging, along with the 15-minute doctor's review, as well as a 30-minute review with me, and the report and the exam is covered for the cost that you see here on all of those options.
So one of the biggest things I think people are going to be asking is, is this covered by my insurance? Because it does sound like it's very, medically oriented. You're working with your doctor. So people will want to know that.
Yes, that is a question I get often. And unfortunately, with traditional insurances, it does not cover. I know a lot of things that are preventative or considered preventative are not covered by insurance here in America, but in some of the other countries, they are. So maybe one day we'll get there. But so as of right now, we do accept HSA and FSA cards. So if you have those, you can use them to pay for your screening. And then we have an amazing referral program that is awesome. I've had people pay for their whole entire scan and get it for free because they referred. So it's $50 off for each person you refer. And that just adds up. So, there's not a limit to it. And then there's also a really great program that we give a percentage of our proceeds to. Every full body scan, we give a percentage of our proceeds to this organization called the United Breast Cancer Foundation. And they so generously will give you up to $150 towards your screening if you are accepted to their program once you apply. So you just do a $5 donation to them, and then I don't know what their parameters are for exactly why they accept someone or wouldn't accept someone, but you answer some questions, and then they let you know if they've accepted you, and you have to get your scan done within the next 60 days. So it's really, really wonderful. I actually used them myself to get a screening done. So it's a great company.
I can see the benefits of this. I mean, we can't see what's going inside of our bodies, and to be able to, detect things that are, not functioning properly before, it gets to its most chronic state, which is why it kills me that, we don't pay for prevention here. We're not in the business of healthcare. We're in the business of sick care. Oh, we only take care of you like once you're sick. And then complain about how much money it costs to, manage your care. So the whole thing just kills me. But I think, for ourselves, it's good to know these things, because otherwise we can't see, we just can't see inside of us.
Absolutely. That's a great point. And I just think the more information, the better. And most people, they want to know what they can do in order to prevent disease or to live a healthier lifestyle. And this tool is a risk-free way to do just that.
Mm-hmm. That's great. So it sounds like from this website, this flowwell.org, you can find a center near you, because like you said, you're practicing in.
Yeah. So I would actually go to btiscan.com. So that stands for Breast Thermography International scan.com, because that's where it shows all the locations throughout the whole nation that you can schedule an appointment with one of the BTI technicians who are trained with, high standard of care. And then of course we get our cameras and equipment calibrated annually, and everything is, up to par. I've just heard some stories about other companies that maybe don't do that. So just, reiterating that you want to go with a reputable company.
Fantastic. All right. So I put the BTI scan website in there as well. So people
Perfect.
who are watching this can go check it out. If they aren't in the area, they can, maybe find a practitioner near them. Well, thank you so much for being on here. It sounds like you just want to educate people about the usefulness of this tool.
Yes.
Just let people know, what it is, because many, probably like myself, I mean, we've heard of thermography and we know like auras and things like that, but we really don't understand like what this could actually do for us. So
absolutely. So I hope some of you are a bit more clear today about what it can do for you. And then again, you can't start too early. I mean, if you can pose for a photo, you can get this screening done. So my dream is to have all young women, starting in their 20s, like getting that screening done, so that the moment that the temperatures rise or change or a pattern develops, we catch that. And that is like so far preventative that it's not even funny. So basically the earlier you start, the better, but there's never too late. It's never too late to start.
Exactly. Thank you so much, Janelle, for being here today and sharing your expertise with us.
Absolutely. Thanks for having me.
Have a great rest of your day, everybody.